The current situation is different, depend on the location, depend on the district and kabupaten or kota we're talking about. For example, is the highest in the full kabupaten kota we study. The highest is in Kabupaten Jayapura, the lowest in Kota Jayapura. The second one is the Mimika, and then the third one is in Jaya, Kabupaten Jaya. So for the highest is about 45, almost 50%, and the lowest is about between about 10% in Kota Jayapura. So it's depend the situation. The factor that also affecting the is vary between that four kabupaten and kota. For example, in the Kabupaten Jayapura and Kota Jayapura is more influenced by the characteristic of the health worker, and the other two kabupaten, Mimika and Jaya, is influenced by the condition of the health center and also the environmental condition of the outside the health center. So the intervention need to be different based on the this factor influence the significant factor influence the condition in every kabupaten and district. So therefore the design of the intervention to reduce the intervention need to be very specific, district specific, and need to be discussed with the policymaker and with the district health office. So this was be done with this study. So we work closely with the stakeholder in Papua, especially the district health office. We discuss the result with them, and then they formulate the design for the intervention. Then right now several design have been implemented in the Kabupaten Kota Jayapura, in Kabupaten Jayapura and Kota Jayapura, also in Mimika and also in Jaya. So hopefully that intervention will be successful. Then we need to monitor. One of our planning is to hopefully we can have resources to follow up to measure what they are doing, how they are doing on the intervention.
I think there are several elements to identifying solutions, and there are two angles. Are first, you need to involve the policymakers and the people responsible for managing those services. Without them being involved, you really cannot define solutions from the outside. The second element of that is involving the communities, I think, has great potential, whether short, medium, or long term. Communities are very aware of the conditions of the services that are supposed to be provided in their communities. They seem to be actually more aware and forthcoming with those reasons than the health workers themselves. So I think tapping this knowledge and commitment that the communities have will also be very important. I think linking these communities to the service providers, to the facilities, to the leadership of these facilities is a critical intervention too. In terms of short, medium, and long term, I think solutions the necessary solutions will change over time. They vary by the district and what's causing the solutions. If you look at, for example, Kota Jayapura, it's largely an urban district. Infrastructure is largely good. And so you would not focus on things like transportation as much as you might in the other locations. However, as Indonesia builds out infrastructure in places like Papua, the infrastructure drivers of absenteeism in places like Mimika and Jaya, and even Kabupaten Jayapura will also become less important. I think the other thing that's critical here is to consider this from the perspective of the leadership of the health centers and the health workers themselves, being aware of what makes them happy about going to their jobs, what makes them motivated about going to their jobs, understanding it from their perspectives will be key. And that, again, varies by conditions across the health centers.